All right. Well, good afternoon, everyone. Thanks for taking time to hop on the call with us today. This is our weekly update call that we are providing. We'll kind of have the same format where we'll start off with a review of the numbers and the data from Jordan, and then I've got a couple just quick updates to provide, and then we'll go with questions. So, Jordan, if you want to go ahead and review data.
Sounds good. I'll pull up the county data to start, so you can look at that while I'm talking. All right, so you can see Kalkaska, Lake, Manistee, and Mecosta are in risk level D, so I believe from last week, Lake has been added to that list, and the other 6 of our counties remain in risk level E. Our daily cases per million and percent positivity do continue to decrease overall for the jurisdiction, with the percent positivity hovering right around 7.5%. We reported 97 new cases from Friday at 3:01 until yesterday at 3. There were 303 new cases over the past week, and the week before that there were 297 cases, so we did see a 2% increase in cases in the past week, so just a little bit, pretty much just holding steady though. And our total number of jurisdiction-wide cases as of yesterday at 3 p.m. was 11,041. Over that time period, cases were identified from schools and household and community contact, care facility employees and other healthcare workers, those in attendance of social gatherings and religious services, recent travel, pre-surgical and pre-travel testing, and other worksite exposures. Cases by county as of yesterday are Crawford with 531, Kalkaska 520, Lake 329, Manistee 717, Mason 1,101, Mecosta 1,780, and I do not have an update for Ferris State because their website has been down all day today, so wasn't able to get that number for you. Misaki 551, Newaygo 2,530, Oceana 1,744, and Wexford 1,238. In the past week, there were 9 deaths reported to us and 353 people recovered. Yesterday, there was 1 positive inpatient case at Munson Healthcare Cadillac, 1 at Munson Grayling, 0 at Munson Manistee, 2 at Spectrum Health Big Rapids, 2 at Spectrum Health Gerber Memorial, and 1 at Spectrum Health Ludington. And then I just have one more screen to share with you with the vaccine update for both District 10 and overall in the counties. Let me just find that real quick. So hopefully this table is a little easier than me just reading numbers to you. You can see the counties on the left, and then the first column is the number of doses that have been given at DHD 10 clinics, and then the next column is the total doses given in each county according to the state dashboard. And this data is as of January 31st. So in the past week, DHD 10 has given 1,574 doses, bringing our total number of doses given to 13,523. Are there any questions?
No, it looks like somebody, Ferris cumulative cases through February 1 are 583.
Awesome. Thank you for that.
Any other questions on the data that Jordan presented?
Yes, this is Jim Truxton. I'm just curious how the statistics work. My wife and I have appointments for tomorrow afternoon through Spectrum Health at the Ludington Hospital. Does that count as a Lake County, or does that count as a Mason County? Spectrum doesn't have a facility in Lake County, of course.
So if you are, it would depend on your residency. So if you're living in Lake County, then it will count in Lake County.
Okay, very good. That's the question. Thank you.
You're welcome.
And so that is different than, Jim, how for District Health Department number 10, our doses are identified by the county that they're given in, whereas the state dashboard is based off of residency.
Okay, great. All right. I just, yeah, wanting to look at the overall statistics there. Thank you.
Okay. And I guess just a little further breakdown on that 13.5, if you're interested. Of that, first doses would be 12,940, and second doses would be 582. This week, all of our clinics, we do have clinics pretty much every day this week, including Saturday, are all second dose clinics. So that second dose number will look a lot different from what it looks like today, the end of the day on Saturday. So. All right, any other questions on any of the data? All right, last week, Dr. Morris did do an update on the, talked a little bit about the two variants that we're finding, the one from the UK and the one from South America, and we now know that both of those have been found in the United States. Probably more prevalent than what's been identified because we're not testing everybody for those. So again, based off the latest information we're getting, the current vaccines that we have, are have been shown to be effective against those. So we're hoping that is going to, that will hold true in the long haul. We do know that we may have 2 new vaccines that will be available, the AstraZeneca vaccine as well as the Johnson & Johnson. There's no official time frame for those, but those would maybe the next 2 vaccines that we're going to be seeing that would join the Moderna and Pfizer vaccine that we're currently using. Vaccine allotment is still, a bit of an issue, although we were on a state call prior to this call where they believe that the amount of vaccine that we are allocated this week will be the same amount that we'll get for the next 2 weeks. So we'll have should have a little bit of stability there in helping us to be able to plan accordingly for clinics. Again, we typically find out what our allotment for the following week is going to be the Thursday or Friday before that, and then we'll set clinics, and then we will go and assign or register people into those clinics. And again, the groups that we are focusing on for immunization remains to be that 1A group, which is the healthcare provider group, in the long-term care type facilities and the AFC homes. A large number of the long-term care facilities and the AFC homes were matched up with Walgreens and CVS Pharmacy. Walgreens had the largest slice of those, and it was intended that they would do their vaccinations. The state has brought on a third pharmacy chain, MHA, that's not Michigan Hospital Association, but it's an umbrella group for a pharmacy chain that is going to be coming in to help address some of the workload that was put on Walgreens. So we may be, they will be helping to vaccinate, and they also will be reaching out to some of the AFC homes and long-term care facilities that either were not matched with one of the 2 pharmacies or had opted out of being matched with them, which obviously, we know we have a few of those in our jurisdiction that we continue to work on. So if this new pharmacy chain is able to take them, then that will take them off our plate as we continue to move forward. So in addition to that 1A group, then we also have the 1B group, and included in the 1B group is going to be those individuals age 65 and up, and we are not tiering those ages. We're following the state guidance of age 65 and up. And then the frontline first responders. And again, that group includes firefighters, police, both state and local, corrections and county jail workers, childcare workers, pre-K through 12 teachers, and those staff in school that have direct contact with children, adult and child protective services, and then homeless shelter staff. So the past 2 weeks we've been focusing in on our educators. Not this week because we're doing all of those second dose clinics, and hoping that we'll be able to wrap up our educators next week, and then we'll pivot back to the rest of that frontline first responders group, including the senior 65 and up. Guidance from the state dictates that they want to see 75% of the vaccine or 75% of our vaccinations going to that 65 plus group, and 25 going to the rest of the group. And even with us focusing on educators, we still are meeting that split. Actually, I believe it's about 80-20, with 80% being the seniors because of that large chunk of seniors we had done previously, and then 20% to the rest of the group. On our website, we have added an interest survey link for the 1C group. And the 1C group, this is not a waiting list, it's simply an interest survey that the employer would fill out and provide us with information on how many individuals they think may be interested in taking the vaccine, and then we'll use that for planning purposes when we get to the point of being able to vaccinate those individuals. So that is out on our website, and the group included in that 1C group is going to be the food and agricultural workers, the critical manufacturing workers, public transit workers, grocery store workers, postal service workers, and workers with unique skill sets not covered above, such as non-hospital laboratories and mortuary type services. So they would be the group that would be considered in that 1C. And again, that would be the next priority group that we would be moving to once we get once we get farther into that 1B group. In terms of a timeline for that, again, on that state call, in terms of moving from one group to the next, or the phase 1A to 1B to 1C, the state has indicated that they would like to see about 70% of that group vaccinated before we make that move. So a lot of that depends upon the amount of vaccine that comes in and the amount of vaccine that we are able to get locally here to be able to do it. What we're hearing is, and again on the state call today, it was shared that for next week's allocation, it's estimated that vaccine, about 70% of what is going to be able to be allocated will be going to local public health departments, and 30% will be going to our hospital partners. Again, at some point, we expect the FQHCs will begin to have access to vaccine to be able to order it. The primary care offices will be able to order vaccine. And then we also know that some of the pharmacy chains will also be able to, order vaccine and begin to vaccinate individuals. The three pharmacy chains in Michigan, Meijer, Rite Aid, and this Cardinal Group that's big in the UP, were the pharmacy chains that were identified, have been certified by CDC and approved by the state to start vaccinating in the communities at some point. So there will be additional opportunities for vaccinations to take place in the community as more vaccine becomes available. So that is what I have in terms of an update on vaccine right now. I'm not sure if there's questions that people may have. No, anybody? I don't know if we have anybody on the phone or not. No other questions this week, guys?
There's one.
Yep.
So has the guidance regarding quarantine after the vaccine changed?
Nothing official on that yet, although what we're hearing is that there may be a change coming soon for those individuals that have completed their vaccination series, but nothing official yet. So as of right now, everything remains the same. Other questions?
Hi, this is Joe at Manistee, and I've asked the question and just having a hard time wrapping my head around how we're at risk level D with our county's positivity rate, according to the CMS website, at 10.6% for the last week. Just can anybody explain that to me?
Jordan, are you able to take that one?
Yeah, I can try. And I tried looking into this yesterday. Bethany had passed along an email from Joe.
Yeah.
I don't know where the CMS is getting their data from or how they're calculating it. The county levels that I show you are from My Safe Start and that website. And then, so let me see, let me look back at Manistee was at 4.4%. And I know that they do not include the prisoners as you had asked. So risk level D is classified as 70 to less than 150 COVID-19 cases per million people in the county, or 15 to 20% diagnostic tests are positive. So since they're at 4.4 for positivity, but they're at 105.1 cases per million in the county, that's why they're in risk level D. But yeah, unfortunately, I'm not really sure where the CMS is, how they're calculating percent positivity, and I couldn't find anything on that website of how they were doing so.
Yeah, I appreciate your trying. I just, like, if it's a mistake, I'd like to, you know, we've got staff coming for twice a week testing now because of that. And it's really kind of a pain. If it's a mistake and can be fixed, great, that we don't have to do this for the next 3 weeks. But otherwise, we're kind of in a jam.
Yeah, I mean, I'm inclined to think that they are including prisoners because even on the state website, when I calculate for the same time period, it was around 5 or 6%, I think. So nowhere near that 10% that you're referring to. So I'm not sure where they're getting it from.
All right. Thank you very much, Jordan.
Okay.
There is another question in the chat. It says, do you recommend tracking employee vaccine completion voluntarily?
I mean, I guess the question would be why. You know, with the vaccine, I mean, this vaccine really being issued under emergency use authorization. You know, I think there would be some questions as whether or not it could be mandated. So I'm not quite sure what the purpose would be for doing that. I mean, I guess if it's something that you wanted to do, you could, but other questions?
There are none in the chat right now, but everyone on the phone lines has been muted. So if you are on the phone and trying to ask a question, you might need to take yourself off mute to ask a question.
Okay, if there aren't any other questions, that's the information that we have to share with you for this week. So if there's something else that, if you have questions after that, let us know. Let me know. We'll try to get you an answer as quick as we can. As I said, we're doing all second dose clinics this week, so I would expect that our the vaccination numbers are going to look a whole lot different from what Jordan showed today, especially that second dose vaccine number. And other than that, again, thanks guys, and everybody stay safe. Take care. Thank you.